Interesting. And there's a connection, too, between adrenal function and thyroid function. So can you talk to us a little bit about that interconnection?
Okay. So the thyroid gets its name from the Greek word thyreos, and it means shield. And I think that's exactly what it's doing for us, okay? I think sometimes what we're trying to suss out clinically and maybe pinpoint as a diagnosis is the thyroid underfunctioning, or rather appropriately functioning on our behalf, because that's its job, right? To pick up shifts in the biochemistry and make changes. I mean, if it's cold, let's say it it revs up the heater. If there's an infection, it gets the immune system going. If there's stress, 16-hour days, coffee, Krispy Kreme, it's going to slam on the brakes. But if these shifts become chronic, I think the thyroid starts to falter and fatigue. And what's more chronic in our modern day than stressors? I mean, they're coming at us in all sorts of different ways, in all sorts of different styles and types, and all the time, chronic stressors. And if you're going to have the normal functioning of the thyroid, you've got to have normal functioning of the adrenals as well. I mean, I've got so many patients, quite honestly, that I hear about their story, and high catecholamine, high cortisol-driven lifestyles that lead to a deficiency state, within time. You've got high cortisol, you're going to have a decreased conversion from T4 to T3. It's going to increase reverse T3. You're going to lose the responsiveness of the receptor site. With low cortisol, I mean, getting that active thyroid hormone into the cell itself is energy dependent, and it's moderated, I should say, by cortisol. And also with low cortisol, you're going to get that receptor site being less responsive. So you need adrenals to be working optimally to get thyroid to be working optimally. Mm-hmm. And I think clinicians can pick this up easily. That story is so important. Tease out those stressors. Some people don't really open up and don't talk about it at first. But I always ask about, their primary relationships, supportive people in your life, and then we can understand where the stressors are. And also, I usually, just to confirm any clinical suspicions for adrenal involvement, I love the 4-point salivary cortisol, just to see if I'm right and how we can support that.
Mm-hmm. Okay, good.